Eastern Cape, where the Department of Health's third annual provincial midwifery seminar returns to East London. This conference serves as an intervention by the Provincial Department of Health to promote the best and safest care for both mothers and babies. The seminar, of course, will address critical issues such as understanding the causes of maternal and neonatal mortality, as well as the early signs of decrease in birth asphyxia. According to the status of women's health in South Africa, there has been progress regarding the institutional maternal mortality in facility ratio. And South Africa has made significant strides in reducing maternal and infant death rates over the decade. But our reporter, Sidima Mfeku, is on the story. Sidima, a good morning to you. Talk to us about the specific measures that will be discussed at the seminar, right, to reduce birth asphyxia and neonatal mortality.
Well, a very good morning to you, Naledi, and to SABC viewers. We are at the East London ICC, where the Department of Health is here to sort of educate and promote care or proper health care for neonatal babies, in fact, to address neonatal deaths as well as maternity deaths. We understand that a lot of programs are going to be going on here, and they're going to be speaking about some of the issues that they face in the maternity wards, and they're also trying to upskill midwives to make sure that they deliver healthy babies. And they are saying that one of the key things that they're going to be addressing is the issue of hypertension, which is also viewed to be one of the contributors to neonatal deaths and maternity deaths. And they're saying there that things like teenage pregnancy are also some of the things that they're going to be looking into and trying to speak about to some of the midwives that are gathered here. But we're now joined by the DDG of the Department of Health. Thank you very much, Dada, for your time. Please just let us in on some of the key things that you want to address inside here, and maybe the purpose of coming here, bringing midwives together.
Thank you very much, and thank you for having me. This 3-day conference is primarily, obviously, to focus on the welfare of pregnant mothers and welfare of the newborns, commonly called neonates, as you know. That's basically a moment and for the frontline workers to reflect on their experiences out there in the front line, and obviously the outcomes that we all know and we always talk about in media and elsewhere in respect of adverse outcomes. But beyond that, they are also here to educate us and advise us as strategies and leadership on what are the key things that need to be put as priority in the times of difficulty like we're going through right now. So we're also here to learn as leaders from the frontline workers. But thirdly, mostly apart from talking about babies, to talk about our midwives, our cadres, our nurses themselves, their own welfare, their own well-being, under difficult conditions under which they operate. So we're also here to motivate them and to show support to what they do. They're doing a great job for the country, and they work 24 hours a day. They work whether there's a tornado, whether there's a war, their babies are always delivered. And we are going to talk about that today.
And also, maybe if we can look at some of the contributors to neonatal deaths and maternity deaths. We understand that the Eastern Cape is currently sitting at ranked number 6 in terms of the immortality rates that are happening in hospitals. What are some of the key contributing factors?
There are a lot of them, well documented, but one that is really giving us sleepless nights is teenage pregnancy, amongst many. We have an increasing number of very young girls from the age of 10 to 16 that are falling pregnant, and we all know that the body is never ready and mature to carry a baby at that age, and therefore the outcomes in general are usually not good. And some of those obviously contribute to medical legals. But in general, that is a big problem that the department is grappling with. We do know that a lot of that cannot be done within the Department of Health. So we're collaborating with other departments and community-based organizations, including churches, traditional leaders, and most importantly, the parents themselves, in order to prevent the scourge of teenage pregnancy The outcomes are not going to improve anytime soon, and the body gets ready after 16 to 18 years to fall pregnant, and that's what the society needs to come and help us. And we need to protect our health systems. These kinds of problems are a real thing that the health system needs society to protect against. We all know that there's a surge in non-communicable diseases, especially hypertension and diabetes, even now affecting women in the childbearing age at a younger age, and that also contributes to the bad outcomes, in maternity areas.
And also, I like the fact that you mentioned medical legal and how, teenage pregnancy and other, maybe shortfalls of the department are contributing to it. We do also understand that it has an element of skills in terms of how skilled the midwives are, and also the issue of staff. So how are we trying to mitigate, these issues so that we don't get to see more medical legal things?
Yes, there are two factors at play here. Obviously, we don't have enough midwives, but also the number of pregnancies in the country continues to increase. Our universities and our colleges are assisting us to produce more specialist midwives, and even actually train other general midwives or general nurses on midwifery skills in order to increase capacity and support to our patients. It is a challenge, but again, it's a challenge that's probably going to recur for as long as the number of pregnancies continues to go up. And the nurses that are trained in South Africa are very attractive to the world because of the quality of training that we do. So we lose a lot of them also to other countries, especially your European and Middle East countries. They are poaching a lot of our skills. Now, of late, Australia has joined, and New Zealand, poaching a lot of our midwives. But we try and train more. But there are a lot of other things, as I say, that look, we also need to strengthen the birth family planning. Let's not call it birth control, family planning, so that we can be able to improve on the quality of outcomes than just quantity, with all the adverse outcomes that we all know.
And you mentioned that as the number of deliveries are increasing by year, there is quite a high demand for nurses or midwives. But now we understand that the Treasury has said that they're going to be freezing some points, or they're proposing the freezing of some vacancies. How is this going to be affecting the department, and what is your stance? Are you for it? Are you against it?
I'm a civil servant. I'm part of those decisions. Austerity measures are taken under special circumstances. Contrary to the general view that austerity measures are necessarily bad, my own experience in this department, austerity measures are usually taken to protect certain essential services in a country. One of those is actually the health system. Through all these years when austerity measures are imposed on government systems, we were never forced to turn away any patient. We always treat our patients. So in a way, I think other departments or other non-essential services are usually the ones that are sort of worst affected. We don't like austerity measures, but for us as a Department of Health, they have an effect of cushioning and protecting us, from many adversities and financial constraints. I'm saying this, but I know that is exactly what we do. I know that the recruitment of staff is usually slowed down a little bit, but critical thing is that services to patients are never stopped.
All right, thank you very much for your time.
Thank you.
That is the DDG of the Eastern Cape Department of Health, Dr. Kamlache, saying there that they understand, even though the National Treasury has said that they're trying, or they're going to be freezing posts for quite some time. They're saying that they do understand that these are measures that have to be taken in order to better delivery of services in other departments, as well as the Department of Health and Education in most provinces has been getting quite a huge chunk of budgets in various provinces, and Eastern Cape is also one of those. And we're still going to monitor what are some of the things that are going to be happening here at the Midwifery Seminar that's here in East London in ICC.